Turned community physician, Dr. Oluwafemi Popoola. He joins us live from Ibadan on the news at 7. Dr. Popoola, let's talk about medication safety. We still have the issue of wrong administration of drugs. There are people with permanent disabilities who will tell you stories of how they were wrongly diagnosed and given wrong doses. And there are people who have even died as a result of issues like that. What have you identified to be the main factors responsible for this, and how can they be resolved, particularly here in Nigeria?
Okay, thank you very much for having me. So as you said, mistakes do happen during the patient care process. And like we all know, this year's patient safety slogan is about medication without harm. These things happen because medical care is a process, and it's quite a complicated process, especially at teaching or tertiary hospital level where I happen to practice. So what is being done as is the commemoration with this day is to increase the awareness about this, let people know that intuitively it's easy to think that these things happen when you have a bad medical practitioner, a bad healthcare practitioner, or people who are not properly trained. But the emphasis now is to understand why these things take place and to put in place systems that make them more difficult to happen, make it more difficult to administer the wrong medication or make it easier to identify side effects and step in. And that is why this commemoration is being done. This program is being, the Patient Safety Day is being celebrated worldwide across Nigeria, led by the Federal Ministry of Health. And the University College Hospital, like other teaching hospitals, has a committee in place. I am representing that committee, and we're doing awareness. That's part of what this is for us, both for clinicians and for patients, members of the public, to become aware of this concern around medication and to teach them how to use their medication safely, to know what they're using, to know the side effects, to know not to mix them with other medications without advice, to ask advice before they stop using their medication, and at all times to be connected with the healthcare system and to use their medications appropriately. Thank you.
Dr. Popoola, let's take the UCH where you work, for instance. Talk to us about what the structure and the system are like, particularly for medical practitioners who make this kind of mistakes. I mean, do they go scot-free? Is there a system that reprimands? What really happens to a medical practitioner who, gives a wrong medication, so to speak?
Okay, thank you for that question. So this is what the Patient Safety Day is all about. You see, the question you've asked me highlights what the natural inclination is. Someone has harmed me, someone has made a mistake, so they should be held accountable. The systems are in place to recognize why things happen rather than just to blame people. That is not to say people go scot-free when they act negligently or they perform what we call malpractice. There are serious consequences for that. But the whole idea is we have a system in place that records patient safety-related incidents, including medication-related incidents that is handled by the pharmacy. And we look into these things. We do root cause analysis to figure out exactly why they happened. And the emphasis is on understanding how the system caused that to happen. Let me give you an example. Some medications come in similar vials. And when you've done this for several years, you learn to recognize the vial. So you can have a dangerous medication and a fairly harmless medication that looks similar. So people work very long hours, late into the night, sometimes even doing operations. It is very natural to mix one medication for the other. So it's, for example, we have systems that actually keep unsafe medications away. So you actually have to deliberately go and access those medications. These are some of the things that are put in place. So it's more about understanding why things happen. It's more about systems than punishing people. But the hospital and all hospitals will have a system to hold healthcare practitioners to account if they perform below standards or they perform malpractice.
I understand that it is human to err. It's just that the implication of the mistakes in your industry is quite different from mine. Honestly, it's a situation where in the twinkle of an eye, someone can just die. But let's talk briefly about self-medication. I've been to the hospital where they will say, oh, there are no drugs, so you have to go and get it yourself. And that's where the issue starts. You're considering an economic alternative, something that is pocket friendly. How do you think we can deal with this? Because this is also affecting our patient safety.
Yeah, thank you for that question. So a lot has been done to ensure safe access, equitable access to medication. These are some of the things that the trust of the current National Health Act, and efforts are being put in place to ramp up local production and etc. In terms of using medication safely, it's unfortunate sometimes that institutions have stockouts. Some hospitals may sometimes experience stockouts, but there are systems around, even if a hospital has a stockout, there are systems in place to support the hospital's activity and to make sure that people still access safe medication. Speaking for my hospital, there's a lot that's been put in place to ensure that we have equitable and safe medication access. And I can assure you that the majority of our patients do get their medications, they get good medication, they get safe medication all the time when it comes to our hospital. So essentially, what's important for members of the public to know is that you should go to a properly accredited and registered pharmacy to get your medication. The University College Hospital has a properly accredited pharmacy, and we have put out some communication even from the director of that pharmacy that advises people on how to handle medication and how to receive their medications equitably. So I think the thing is to learn that sometimes you might be penny wise and pound foolish. You know, this culture of people sometimes walking up to unlicensed practitioners and telling them, I have 5 naira, I have 15 naira, please give me what treats this for 15 naira. Very often that doesn't result in equitable or proper healthcare. And these are some of the things that have been addressed to the National Health Act and the National Health Insurance Act. And even Oyo State has a health insurance scheme as well. So the thing to encourage people to do right now is to get on this insurance scheme, make sure you plan for your health, before the events actually occur.
Dr. Oluwafemi Popoola is a consultant community physician with the University College Hospital, Ibadan. Thank you for talking to us tonight.
Thank you for having me.